I want to review some of the things that we are going to be discussing during our time together over the next few minutes. I thank you so much for joining us for this introduction to ACEs 101. So I want to talk a little bit about what ACEs are, what they consist of. I want to help us identify a few key terms, understand some of the impacts of ACEs, but I don't want to stop there. I want us to also consider some prevention strategies and some things that we can do to actually mitigate the impact or the effect of ACEs or adverse childhood experiences. So here are a few key terms, and I want us to start with defining these four key terms: adverse childhood experiences, trauma, toxic stress, and social determinants of health. And the reason that I want us to start here is because these terms interrelate. Sometimes they get confused one with another, and they all feed into each other. They build on each other as far as the definitions go and how they interact with each other. The experiences interact with each other. So let's begin by talking a little bit about adverse childhood experiences, or ACEs, as they're commonly known. So ACEs are potentially traumatic events that occur in childhood. The thing about ACEs it can include environmental factors as well as occurrences or occasions. And we're going to pull and tease this apart a little bit as we go through our time together today. But the thing about ACEs that I want you to kind of keep in the back of your mind is that they are linked to some really profound chronic health conditions. And when I talk about chronic health conditions, I'm talking about emotional health and mental health conditions, but then also physical health conditions. What is trauma? Trauma is an experience of serious adversity or terror. So trauma, I often think of trauma or a traumatic event when I'm thinking of trauma. So something like a car accident or seeing something really scary in your neighborhood or your home, these I often associate with the definition of trauma. And that's true. It can be the experience of serious adversity or terror, as we discussed, but it can also be how we react or how we respond to that experience. So trauma is a little bit more complex than just the thing that happened. It's how we experience or remember or play into the thing that happened. Let's talk next about toxic stress. So toxic stress is different than regular stress. And I think about toxic stress kind of like an equation. So when I say that, what I mean is the things that you see on your screen in light green minus the things in light blue can equal the thing in dark green. So let's unpack this a little bit, but I want to start with what is stress. We often associate stress with something that is negative, has a negative impact on our lives, and that can be true. There have been many studies that link stress to negative health outcomes, but in reality, there is some aspects of stress that we call positive stress. And you might be thinking, no, I just don't agree with that. But let me explain a little bit. So positive stress can be the sensation of butterflies that you get whenever you are starting a new job. It can be the experience of walking into a party and you don't initially know anybody at that party. And you might have that sense of uncomfortableness or some butterflies in your stomach. But what happens is whenever you start a new job, you start to get to know the work, you get to know your colleagues, your coworkers, and you get to know your environment, and you slowly become more accustomed to going to work every day, and it doesn't feel stressful anymore. Same with a party. You walk in, you don't initially know anybody, but then you identify a friend across the room, you head over and you start chatting with that friend, and all of a sudden that stressful moment goes away. So this is an example of positive stress. This happens in childhood, really early in childhood, actually. So positive stress occurrence in childhood can be an experience of a baby coming into this world brand new, and the baby grows accustomed to mom's arms, mom's face, the feel and the smell of mom, and mom is very comforting to this child. Well, then all of a sudden, grandma comes over and grandma wants to hold the new baby, but grandma smells different, she looks different, she feels different. And so this can be a stress response in that infant. But what happens is that infant starts to recognize that grandma is a nice, safe, comfortable person to be with as well. And so the stress response subsides. That's an example of positive stress. There's another example of stress called tolerable stress. Now, tolerable stress is an example or an incident of stress that creates a bigger or more profound impact. So an example of this might be the death of a loved one, the death of a caregiver or parent, and you're probably saying, wait, that seems really profound. And you're right, it is really, really profound. But what makes tolerable stress tolerable is whenever you have supportive parents, caregivers, loved ones, family members, and a safe environment around you that can help bring you from that really profound, stressful occasion, like the death of a loved one, into a more hopeful, helpful, happier position after a period of grief. And so tolerable stress is tolerable because what and who is around you when you're experiencing that stress. So again, let's turn back to the screen and think about toxic stress. I said it was an equation. The things in light green minus the things in light blue equals the things in dark green. So what makes stress toxic? Stress is toxic whenever you have repeated occurrences or occasions of stress, minor or major, things that are very big in a child's life or in your life, or things that seem kind of simple or passive, things like starting a new job. But if you do not have the minus, supportive adults or safe environments, it can result in long-lasting impacts on your body and on your mental health. So that's what toxic stress is about. It's about experiencing really profound things within your life, but not having the support around you that you might need to help mitigate the effects of that stress. So what happens when we experience stress? So when we have a stressful occurrence, let's go back to thinking about just those positive stress moments for a second. Our body engages in a fight or flight experience, but then we recognize our friend across the room. We get to know our colleagues or our coworkers at work. And we are able to regulate our body, come back to a sense of calm. Our systems kind of go, okay, I'm fine, I'm okay. Over the course of our lives, we get to practice this oftentimes. People who have supportive adults and safe environments, they get the chance to practice how to return back to calm. Whenever children and whenever adults also experience toxic stress, what is happening is that they never have the opportunity to learn how to regulate their body. Their body never comes back to a sense of calm after the stressful experience or the stressful occasion, because they don't have supportive adults or supportive and safe environments around them to help them figure out how to re-regulate after a stressful occurrence. So these stress moments almost pile up upon each other. So again, toxic stress is a really important factor when we start thinking about adverse childhood experiences. The last thing I want to define for us is social determinants of health. So I often think about ACEs or adverse childhood experiences as the experience, the occasion, or the occurrence that happens within childhood, whereas social determinants of health are oftentimes the contexts or the conditions in which children live and grow. And this can also be true for adults, but we're thinking really in terms of children when we think about adverse childhood experiences, because they do have an effect into adulthood. And these experiences can start they can start prenatally. And we'll talk a little bit more about that further in this presentation. So what are social determinants of health? These are the conditions, like I said, the conditions or the contexts in which people live, where they work, where they grow, and into which they are born. These can be things like violent and unsafe neighborhoods. These are things like unsafe or not clean places to play outdoors. It can be a food desert. It can be the lack of well-paying jobs in an area. It can be the lack of healthcare and education. These are the conditions or the contexts in which children are born and grow and live. So I do want to point out, as we continue to talk about the relationship between social determinants of health and ACEs, sometimes we have some confusion around things like race and racism, sex and sexism. I want to make sure to point out, as we continue to build out this argument, build out this description of what social determinants of health are, I want to make sure to point out that things like race and sex are not social determinants of health. These are not bad things. What happens is that whenever race and sex are treated oppressively, or when people are marginalized because of their race or because of their sex, this is called racism and sexism. So what I call as the isms, racism, sexism, heterosexism, these are all examples of social determinants of health. But race is not a bad thing. Sex, having a body with a certain sex is not a bad thing. It's how that gets treated within the context in which we live. So I just wanted to make sure to be very clear about how we think about some of these isms and these oppressions when we start talking about social determinants of health. And in this image on your screen, we see how social determinants of health can play into what is called the ACEs pyramid. So the ACEs pyramid is something that was developed by the CDC, the Centers for Disease Control and Prevention. And as you can see, you follow the arrow, that image on the left of your screen is of the social determinants of health, and you follow the arrow to the two bottom rungs of the pyramid. And so let's talk about this pyramid and how it functions and what it's illustrating. So the first thing I really want to say is that this pyramid is an example. It is not a foregone conclusion. So as you're listening to how this pyramid functions and what it illustrates, I want you to take into account that not everybody who experiences these occurrences or these occasions or these contexts will have an early death or will experience disease and some of the health outcomes that are associated with adverse childhood experiences. So let's start with the bottom. Social determinants of health are things like generational embodiment or historical trauma. These are things like racism, poverty, things that impact the context in which people grow, work, live. The next rung are the social conditions or the local context. So these are aspects of a community like access to good paying jobs, that safe place to play, the food deserts. These are things that would fall into the social conditions or local context. Now, I want to put this into kind of a story format to help illustrate how this pyramid functions. Let's take, for example, a child who's born into an impoverished neighborhood in which there is a lot of historical trauma. There's the effects of systemic racism that is impeding the thriving of the community itself, not just the family that she's born into, but the community itself. She's born into a family in which the parents might have to work multiple jobs, and therefore it impedes the access to childcare. Perhaps she has to just go to whomever is available when the mom has to work. So she might be passed from caregiver to caregiver, and she doesn't have a steady caregiver or set of caregivers within her life because she's kind of going from school to school or from relative to relative or friend to friend based on access to high quality caregiving. and the lack of access, I should say, of high quality caregiving. And so she might start to experience an adverse childhood experience. The mom who is working really hard to get food on the table, to pay bills, she may inadvertently neglect the child. And it may not be something that she's wanting to do or that she's even conscious of the fact that she's doing, or that mom herself may not be living in a stable relationship or a healthful relationship where she's treated well. And so the child will experience an adverse childhood experience. This can impede that neurodevelopment. So let's go kind of back in our minds to where we were talking about toxic stress. Because of the environment and the conditions of relationships and context that that baby was born into, her neurodevelopment, it never has the chance to help her understand how to return to a calm, never self-regulate, never come back from stressful situations. And it can impact her social and emotional and cognitive development as well. She can start having struggles at school with her learning, with making friends, with knowing how to have trusting and healthful relationships in her life. And this can perhaps lead to the adoption of risky behaviors because she is not adequately equipped to develop meaningful, trusting, healthful relationships. She may find herself in abusive relationships, or she might find herself in positions in which she is more likely to use drugs as a coping mechanism, or in a relationship in which she's pressured into having sex before she is ready and has adequate understanding about sex. And so this is an example of an adoption of health risk behavior. This can lead to disease, disability, and social problems. Some of her occurrences in which she has had struggle forming bonded, healthful relationships might cause other social problems in her life. She might contract a sexually transmitted infection, and she might have other diseases related to some of the contexts and conditions in which she lives. Perhaps access to good food impacts her ability to maintain weight, might experience diabetes, and this can lead to early death. So again, this is just an illustration of how this pyramid functions and what it's illustrating. It's not a foregone conclusion. So that's kind of how ACEs and social determinants of health function together. But I think that this is another model or illustration that can help put into context some of the nuances and differences between ACEs and social determinants of health. So this illustration shows at the top some of the ACEs or adverse childhood experiences that people might experience. These are the occasions or the occurrences that happen in childhood: maternal depression, abuse, neglect, domestic violence in the home, homelessness, mental illness in the home, divorce, physical and emotional neglect. And the roots of the problem are the social determinants of health, or the context or the conditions in which children grow and live. So things like poverty, discrimination, violence in the neighborhood, lack of opportunity for economic mobility, social capital, poor quality of housing. So let's start talking a little bit about ACEs specifically. So let's start at the beginning. Back in the 90s, there was a study done by the CDC and Kaiser Permanente that studied these 10 ACEs. I'm going to call them the original or classic ACEs. And in this study, what they started to identify were these occurrences in people's childhood were being linked to poor health outcomes like cardiac problems, cardiac health issues, diabetes, anxiety, depression. what this study did is it interviewed and asked, I should say it surveyed adults. And this is a retrospective study. So adults thinking back on their own childhood. And so they started to link abuse, neglect, and what they deemed household dysfunction to these later health outcomes in adults. So it was adults thinking back on their childhood. And these are the original ACEs. Since the 90s, there's been some studies emerging that show other things may be classified as ACEs. So depending on the circle in which you're talking, when we think about or when we say we're talking about ACEs, oftentimes these are the 10 that come to mind. But know that as studies have emerged and as the research has progressed, the expanse of ACEs has also progressed. But these are the original or the classic 10 ACEs. And you might be thinking, how common are ACEs? Because I am starting to identify some things in my own life or in the life of the children that I work with or my own children that might be classified as ACEs. Well, you're right. And ACEs are incredibly common. In surveys, it's found that about 61% of adults have experienced one or more ACE. And then you look at the chart to the left, which was put together by the CDC, and you can see that 4 or more, 12.5% of the population have experienced 4 or more ACEs. So they're incredibly common. The Center for Children's Health has put together a survey that they conduct every 3 years. It's the Child Health Needs Assessment. And this year, I should say last year, in 2021, they did a survey, their most recent survey, and they included some questions related to adverse childhood experiences. And so they surveyed parents and caregivers in the 8-county area, service area that Cook Children's provide services for, and they asked a few questions related to ACEs. And this is some of the information that they turned up. So in Tarrant County, 82,420 children have experienced 2 or more ACEs. So it's incredibly prevalent, even here in Tarrant County, even within our 8-county service area. And you can see that on the graph in the second bar on the graph. Now, when they were looking at what ACEs they were going to inquiry or what ACEs they were going to ask about, they used the National Survey of Children's Health as the model by which that they could compare their data to the data available in Texas and the United States. And you'll see in the next slide that the National Survey of Children's Health uses a few other modicums or types of ACEs that are not a part of that original 10 that we first talked about. So that's one of the reasons why I wanted to help us identify the fact that there's studies related to the original 10, the CDC Kaiser Permanente study, and then the research has expanded and grown in really meaningful and significant ways to include other things as ACEs that weren't included in that original study. And so again, back to this particular graph, we can see that ACEs are incredibly prevalent in Tarrant County, but they track really closely to what we see in the 8-county service area of Cook Children's in Texas and across the United States. And I do want to point out that Tarrant County and the 8-county, that data comes from 2021, whereas the ones from Texas and the US come from 2019, which was the most recently available data. So I do want to kind of make sure that you make note of that. So this is the slide where we start to see what types of ACEs are really prevalent within our community. So I am not at all surprised to see that a parent or guardian experiencing a divorce and the child living in a home where that has happened is the most prevalent type of ACE. And that is true across the 8-county region, across Texas, and in the United States. Divorce is the number one experience of ACE or type of ACE that children experience. Children who live with someone who has a mental illness, who has a suicide ideation or has attempted suicide or is depressed is the second. And a child who lives with anyone who has experiences with alcohol or drug problems is the number 3 occurrence of ACEs within Tarrant County, 8-county service area, and in Texas. So I want to point out also that you'll start to see how some types of ACEs show up in this data that were not a part of those original or classic 10 ACEs. So the bottom example is a perfect example where a parent or a guardian died. That was not included in the evaluation of the first or the original ACEs study. So we are starting to see that other things can be classified, or maybe should be classified, as adverse childhood experiences. You might be thinking that, yeah, there's a lot of things on that we've talked about so far that have impacted my children or the children I work with, that haven't appeared on these slides, but are really profound impacts. And so our team, as we started to think about ACEs and the impact of ACEs in our community, we started to think about what are some other things that are not included in that original Kaiser study that we could see that could be determined as ACEs. And some emerging research is showing that the COVID-19 pandemic may in and of itself be classified as an ACE. And so there's emerging research there, but then we talked about the death of a parent or a caregiver as a really profound experience, and that's something that's picked up in some of the data nationally and then also within our service area. Then other things like deportation or separation, being victimized by a crime, bullying in school, homelessness, witness to neighborhood violence can sometimes be considered an ACE, whereas we think about social determinants of health as being the neighborhood is violent, that's the context or the condition of the neighborhood, but then also witnessing that violence can be an experience of an adverse childhood experience, or the occasion or occurrence of that witnessing of violence. The caregiver losing a job, the fear of what happens economically to the family, or a family member dies by suicide or attempts suicide. These are all examples of ACEs that are not included in that original Kaiser study, but I think so I should say there is quite a bit of emerging data that links this to adverse outcomes in the future for some of the children who have experienced these things, but then also just are very profound. And you might be thinking of some things, and you might even want to jot down some things that you think of that you haven't heard so far. So ACEs are incredibly costly. We've talked about that a little bit. 61% of adults have experienced one or more ACE, but they're costly in terms of our health. They impact our physical and our mental health. So here on the screen, we see that they're associated with asthma, heart disease, obesity, depression, anxiety. So they're really costly to our physical and mental health. But then they're very, very costly because they're intergenerational. The impact can be passed on from one generation to the next. So let's think about that ACEs pyramid. The conditions of the mother of the child impacted and made it difficult for that child as she was born and as she grew into that family and into that community. And she may have experiences in which she passes along some of the lessons, the poor lessons learned, or the experiences that she has had to her child. So they can be costly because they go from generation to generation. They're also financially costly. So they can cost $748 billion a year. And that's something that is evaluated here in North America. So they can cost us financially. And when we think about the cost of an ACE, we are thinking, yes, in terms of the healthcare costs, both for physical and mental health, but we're also thinking about the loss of opportunity, both for work and for education. And so those get factored in as well. So ACEs are incredibly costly. I want to take a look at this chart. This is something that was developed by the CDC. So this is another way that we can think about the lasting impact of adverse childhood experiences. ACEs have been linked to injury, mental health problems, maternal health, infectious disease, chronic disease, risky behavior, and the loss of opportunities. And so this is another way in which we can think about the lasting cost or consequence of adverse childhood experiences. There are some groups that are a little bit higher risk of experiencing an ACE. So people who are making less than $15,000 a year, so those who live in abject or profound poverty, are more likely to experience an ACE. Black, Hispanic, Latinx, or multiracial people are. And I want to pause because I've had some questions in the past about what is Latinx. Latinx is an inclusive term for Latina, Latino, and it's a way of engaging those who identify as Latino or Latina in a non-gendered way. So it's an inclusive term for the inclusive term is Latinx. Those who live with less than a high school education, and that has to do with loss of opportunity, loss of income, loss of higher education, and jobs. People who are unemployed or unable to work, whether from a disability or from some other circumstance in their life that makes it difficult to find work and to maintain work. And then LGBTQIA+, those who identify as lesbian, gay, bisexual, or transgender are at a greater risk of experiencing ACEs or adverse childhood experiences. This has been pretty heavy so far. We've talked about some really heavy things and the lasting consequences of adverse childhood experiences. But I don't want us to stop there, because there is some great research that is coming out and that is already established that delineates and identifies for us what we can do to prevent ACEs. So on the right is just an example of something that the CDC put out, and it's a whole PDF that has some great information about how we can prevent adverse childhood experiences. And I put the link at the bottom, but in reality, you can just Google preventing adverse childhood experiences, CDC, and you'll get a link right to this PDF, and you can browse it, read it. But one of the things that is really, really important to highlight from this periodical is that if you create and sustain safe, stable, nurturing relationships environments for children and families, it can actually prevent ACEs and help children reach their full health and life potential. So I want to point out, what do we do to prevent ACEs? How do we prevent ACEs? It's by creating and sustaining healthful relationships and environments. So let's go back and think about that toxic stress. Remember that equation? When we have supportive adults and safe environments, it can help children manage stress. So important to have supportive adults and relationships and safe environments for children, because it can also help prevent ACEs. So here are a few strategies that can be used to prevent ACEs. So we can ensure that there is good primary care with victim-centered services. So not just primary care, which is really, really important. We need to make sure that families have access to primary health and mental health care. I should say physical and mental health care. But it's really helping clinicians provide victim-centered services. So recognizing that if a child comes in with a stomach ache or consistent headaches, or if they're starting to show signs of diabetes, perhaps the clinician can pause and think, what is happening in that child's home or in the environment in which that child lives that may be contributing to this child's health outcome. And that's true for mental health services as well. Recognizing that some occasions in which children come into offices may be due to past trauma or past experiences that are adverse within their home or within their environment. And so having clinicians pause and think, what has happened in this child's history that is impacting how they're presenting in our office today? Making sure that there's family-centered treatment for substance use disorders. So substance use is something that is profoundly impactful and has been considered one of the ACEs for a really long time, a child living in a home in which there is a substance misuse. So making sure that people have access to that. And then the other is just ensuring a strong start for early childhood with access to good education, early childhood education. And I want to really make sure to note that these are just 3 very small examples of what we can do to prevent ACEs. That resource on the previous slide, it's also mentioned here at the bottom. It offers so many other examples of what we can do to prevent ACEs. We can make sure that we participate in public education campaigns. We can pay attention to legislation that comes down and advocate for good legislation, good access to healthcare, early childhood education, safe environments and safe places to play within our neighborhood, being an advocate in our local government. We can also make sure that we incorporate men and boys into our strategies for preventing ACEs. Another thing that we can do is just help children learn good social and emotional skills. How do you form good, healthful, supportive, mutually nurturing relationships within your own life? How do you know how to say no to things that may be risky to your health, may create risks, unneeded risks to your health? How do you help children deal with bullying? How do you help children relate better to their families and families relate better to their children? So parenting skills and family bonding strategies. These are all examples of ways that we can actually prevent ACEs. So let's talk a little bit about moving from adverse childhood experiences to positive childhood experiences. So ACEs to PACEs. So emerging research is showing that positive childhood experiences before the age of 18 are profoundly beneficial. They actually can counter the effect of an ACE or of ACEs. It results in better health outcomes. And again, having those positive childhood experiences can help that child develop skills for resiliency. So again, think back to the toxic stress. It enables a child to bounce back after a stressful situation or a stressful occurrence in their life, because they have had positive childhood experiences, because they have safe environments and supportive adults in their lives. So what are some examples of some positive childhood experiences? I think having experiences with healthcare professionals that are good and safe is a really important one, particularly within the healthcare field or early education environments, making sure that children have good experiences with professionals. And I think that for LGBTQ populations, remember they're one of the ones most at risk for experiencing an ACE. This is really important. So finding healthcare professionals that will treat them with respect and dignity is really important. Finding people with whom your child can talk. So I'm talking about nurturing safe environments within your own family, but then also finding supportive adults that are not parents who can show an ongoing interest in your child or the children that you work with. And that's something that you can do as a mentor or as a teacher, as a healthcare professional. You can invest in the lives of children, because particularly whenever children reach the teenage years, sometimes it's really hard to talk to their parent. But if you've fostered a positive relationship for your child with a family friend who shares similar values, that your child may turn to them when they need some help, when they need to talk about what's going on. And they may do that before they turn to you as a parent. And that can be really hard for parents from what I've heard, but that's something that can be really beneficial to children, is to have non-parent adults who show an ongoing interest. Making sure that you have avenues for your child to participate in community traditions or faith traditions. So we see on the bottom of the screen on the left, a little boy who has participated in Holly, another girl who is participating in ballet folklorico. These are all examples of positive childhood experiences. So that's an overview of adverse childhood experiences and some prevention strategies. I do want to invite you to click the QR code and fill out a really short survey. I think it's only 4 or 5 questions, but what that does is it helps us refine the curriculum, make modifications and changes so that other people who take this course in the future will have a good experience and will continue to expand the learning possibilities. So if you would take a moment to do that, I would appreciate it. And then I also want to invite you to reach out if you have any questions or comments. We want to be available to help answer those. Thank you so much for taking time to be with us today, and I hope you have a good day.